Introduction. COVID-19, also known as the novel coronavirus, is a highly infectious respiratory illness caused by the SARS-CoV-2 virus. The outbreak of the virus was first reported in Wuhan, China in December 2019, and it has since spread rapidly across the globe. The pandemic has affected millions of people worldwide, causing widespread panic and disruptions to daily life. In this essay, we will discuss the impact of COVID-19 on various aspects of society. Impact on health. The COVID-19 pandemic has had a significant impact on public health globally. It has caused millions of infections and deaths worldwide, and healthcare systems have been overwhelmed in many countries. The virus primarily affects the respiratory system, and symptoms range from mild to severe. High-risk groups, such as the elderly and those with underlying medical conditions, are more vulnerable to severe illness and death. Vaccination efforts are ongoing worldwide to combat the spread of the virus. The impact of COVID-19 on public health has been unprecedented. As of May 2023, the virus has infected over 300 million people and caused more than 5 million deaths worldwide. The rapid spread of the virus has overwhelmed healthcare systems in many countries, leading to shortages of medical supplies and equipment and a lack of hospital beds. Healthcare workers have been on the front lines of the pandemic, risking their lives to treat patients and prevent the spread of the virus. The symptoms of COVID-19 can range from mild to severe and can include fever, cough, and difficulty breathing. In some cases, the virus can lead to severe respiratory illness, pneumonia, and death. High-risk groups, such as the elderly and those with underlying medical conditions, are more vulnerable to severe illness and death. Long COVID, a condition where individuals experience symptoms that persist for weeks or months after recovering from COVID-19, has also emerged as a significant concern. The development and deployment of COVID-19 vaccines have been crucial in combating the spread of the virus. Multiple vaccines have been authorized for emergency use worldwide, and vaccination efforts are ongoing. However, vaccine hesitancy and supply chain issues have posed challenges to the vaccination campaign. The emergence of new variants of the virus, such as the Delta variant, has also highlighted the need for ongoing vigilance in the fight against the pandemic. In conclusion, the impact of COVID-19 on public health has been significant, causing millions of infections and deaths worldwide. The pandemic has highlighted the importance of investing in public health infrastructure and preparedness, and the need for global cooperation in the face of future pandemics. Vaccination efforts remain a crucial component in the fight against the pandemic, and ongoing research and development will be necessary to stay ahead of emerging variants of the virus. Impact on economy. The pandemic has had a significant impact on the global economy, causing widespread job losses and a decline in economic activity. Many businesses have had to shut down temporarily or permanently, leading to a rise in unemployment rates. The pandemic has also disrupted global supply chains, causing shortages of essential goods and driving up prices. Governments around the world have implemented stimulus packages to mitigate the economic impact of the pandemic. The COVID-19 pandemic has had a profound impact on the global economy. The measures taken to contain the spread of the virus, such as lockdowns and travel restrictions, have led to a decline in economic activity. Many businesses have been forced to shut down temporarily or permanently, causing widespread job losses and a rise in unemployment rates. Small businesses, in particular, have been severely impacted by the pandemic, with many struggling to stay afloat. The disruption of global supply chains has also been a major challenge during the pandemic. The closure of factories and restrictions on transportation have led to shortages of essential goods, such as medical supplies and personal protective equipment, as well as everyday items like groceries and electronics. This has driven up prices, causing inflation in some countries. Governments around the world have implemented stimulus packages to mitigate the economic impact of the pandemic. These measures have included cash transfers, tax relief, and financial support for businesses. Central banks have also taken steps to support the economy, such as cutting interest rates and purchasing government bonds. The pandemic has also had a significant impact on international trade and tourism. The restrictions on travel have led to a sharp decline in tourism, which has had a major impact on countries that rely on this industry. International trade has also been disrupted, with the closure of borders and restrictions on transportation leading to a decline in exports and imports. In conclusion, the COVID-19 pandemic has had a significant impact on the global economy, causing widespread job losses, disruptions to supply chains, and a decline in economic activity. Governments around the world have implemented stimulus packages to mitigate the impact, but the long-term effects of the pandemic on the economy remain uncertain. The pandemic has also highlighted the need for greater investment in public health infrastructure and preparedness to better manage future pandemics. Impact on education. The pandemic has had a profound impact on education, with many schools and universities being forced to close or shift to online learning. The switch to online learning has posed challenges for both students and educators, including a lack of access to technology and resources, and difficulties in maintaining student engagement. The pandemic has also highlighted existing inequalities in the education system, particularly for marginalized and low-income students. The COVID-19 pandemic has had a profound impact on education worldwide. Schools and universities have been forced to close temporarily or shift to online learning to prevent the spread of the virus. The switch to online learning has posed significant challenges for both students and educators. One of the most significant challenges of online learning is a lack of access to technology and resources. Many students, particularly those from low-income households or rural areas, do not have access to computers or high-speed internet, making it difficult for them to participate in online classes. Teachers and professors have also faced challenges in adapting to online teaching methods and providing effective instruction in a virtual environment. Another challenge of online learning is maintaining student engagement and motivation. The lack of face-to-face interaction can make it difficult for students to stay focused and engaged, leading to a decline in academic performance. This has been particularly challenging for younger students who may require more supervision and support from their teachers and parents. The pandemic has also highlighted existing inequalities in the education system, particularly for marginalized and low-income students. These students may not have access to the same resources and support systems as their more privileged peers, exacerbating the digital divide and widening educational disparities. In conclusion, the COVID-19 pandemic has had a significant impact on education, with the shift to online learning posing significant challenges for both students and educators. The pandemic has also highlighted existing inequalities in the education system and the need for greater investment in technology and resources to ensure that all students have access to quality education. As the world continues to grapple with the pandemic, it is important to prioritize education and support the development of innovative solutions to ensure that students can continue to learn and thrive in a safe and supportive environment. Impact on mental health. The pandemic has had a significant impact on mental health, with many people experiencing stress, anxiety, and depression. The isolation caused by social distancing measures has exacerbated mental health issues, particularly for those living alone or in abusive situations. The pandemic has also highlighted the need for accessible mental health services and resources, particularly for frontline healthcare workers and other essential workers. The COVID-19 pandemic has had a profound impact on mental health worldwide. The uncertainty and stress caused by the pandemic have led to an increase in mental health issues, including anxiety, depression, and post-traumatic stress disorder, PTSD. The isolation caused by social distancing measures has also exacerbated mental health issues, particularly for those living alone or in abusive situations. Frontline healthcare workers and other essential workers have been particularly vulnerable to the mental health impacts of the pandemic. These workers are at a higher risk of contracting the virus and have been working under extremely stressful and challenging conditions. The pandemic has highlighted the need for accessible mental health services and resources for these workers to help them cope with the psychological toll of the pandemic. The pandemic has also highlighted existing mental health disparities and the need for greater investment in mental health services and resources. Marginalized and low-income communities have been disproportionately impacted by the pandemic and may not have access to the same mental health resources as more privileged communities. In response to the mental health impacts of the pandemic, many organizations and governments have implemented mental health support programs and services. These include teletherapy services, online support groups, and mental health hotlines. However, there is still a need for greater investment in mental health services and resources to ensure that everyone has access to the support they need during these challenging times. In conclusion, the COVID-19 pandemic has had a significant impact on mental health, with many people experiencing stress, anxiety, and depression. The pandemic has highlighted the need for accessible mental health services and resources, particularly for frontline healthcare workers and other essential workers. As the world continues to navigate the pandemic, it is important to prioritize mental health and support the development of innovative solutions to ensure that everyone has access to the support they need. Conclusion. The COVID-19 pandemic has had a significant impact on various aspects of society, from public health to the economy, education, and mental health. The pandemic has highlighted existing inequalities and vulnerabilities in society, and it has underscored the importance of preparedness and resilience in the face of future crises. While the pandemic has been challenging, it has also demonstrated the resilience and adaptability of individuals and communities around the world. By working together, we can overcome this crisis and emerge stronger and more resilient.